It's one of the most common medications, aspirin, and many of us reach for it without even thinking twice. But are we always using it the right way?
Well, joining us in this sponsored segment to help break it all down is Assistant Professor of Pharmacy Practice at Cedarville University, Dr. Shannon Yaros. Dr. Yaros, thanks for being here.
Yeah, thanks for having me.
So this is a first for me. I don't know what aspirin is, so I'm glad you're here to help me understand. Yeah. What is baby aspirin, and should I take baby aspirin daily? I know that's a common question you get a lot.
Yeah, it is. I get that question a lot, actually. Some people know it as baby aspirin, some people know it as low-dose aspirin, but really what it is aspirin at 81 milligrams. You can get it over the counter. It can be used for many different things, but some people know it as heart protection. So I have people come in and say, should I be taking an aspirin? And what I really wanted everyone to know is there is some people that it works well in and should take it, but it might not be for everybody. So this is one of those instances where you really do want to talk to your healthcare provider to know if it would be beneficial for you.
Yeah, and speaking of heart protection, so is taking more better for heart protection? And also, is there specific brands that you want to tell us about that people should use?
Yeah, so taking more, and as a general rule, I always tell everyone, you don't want to take more of something if your provider has not told you to do so. So you always want to stick with the amount that they've told you, and so more doesn't necessarily always mean that it will give you more protection. So always talking with your healthcare provider on what you should be taking. As for brands, usually what I tell everyone who comes in, it's more about what's best for you. So there are different formulations of aspirin. There's an enteric-coated version, which means it's kind of, it has this enteric coat that kind of helps with some stomach upset. There's also chewable tablets. So if you prefer chewable, you can use chewable tablets. So really it's more a personal preference and looking at what formulations they'd like and even price point.
Yeah, I mean, a lot of different options for people to choose from, which is super nice. And so continuing to talk about aspirin, what are the risks of taking baby aspirin every day?
Yeah, so there are side effects with aspirin. Some of the ones that really stand out to me are it can cause stomach irritation or some of that stomach upset, especially if you're using it every day. And then if you already have some, maybe ulcers or things like that, you want to keep that in mind. Another big thing that I think of is bleeding risk. So it can increase your bleeding risk, especially if you're taking it every day over time. So you really want to talk to your healthcare provider and your pharmacist about maybe some signs and symptoms to look for of bleeding. Also, it can interact with other medications. So if you are starting aspirin, make sure that your healthcare provider knows and your pharmacist knows all the medications you're taking, including over-the-counter medications and herbal products and supplements.
Well, that's a very good point. And if you're at home and thinking, I have more questions, you can submit those health or a medication question by going to Ask the Pharmacist, cedarville.edu/askthepharmacist. Dr. Yaros, thanks so much for being here.
You're welcome. Thanks for having me.
Absolutely. And Ask the Pharmacist is presented by Cedarville School of Pharmacy.